Okay, so hello and welcome to HIPAA Healthcare Solutions webinar. We're excited to share our webinar on NextGen, Best Practices for HIPAA Security Risk Assessments with you today. My name is Chelsea Grover and I'm the Marketing Communications Coordinator at HIPAA. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of these slides and recording within the next week. Next, for those of you who aren't familiar with HIPAA, I wanted to share a bit of who we are with you. We specialize specifically in NextGen Healthcare. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen, and we have two NextGen add-on solutions for NextGen, ChartGuard and Refund Manager. Next, I wanted to share a bit about HIPAA One with you. HIPAA One is a company that we're doing this webinar in partnership with. They are true experts in the industry, and we're very eager to have them with us. They are in HIPAA compliance and data security. They do risk analysis software, and they developed and maintain everything in the U.S. Okay, so next I wanted to mention that we have an upcoming educational webinar on May 3rd. It's on monitoring payer performance. Are you leaving money on the table? I'll be sending out an invitation to that soon, so keep your eyes open for it. Okay, so back to today's webinar. At the end of the presentation, we're going to open the floor up to questions from you. We'll answer all the questions at the end, but you can type the questions in the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions in the questions box. So without further delay, I'd like to introduce our presenters for today. Stephen Marco is President and Founder at HIPAA One. Bobby Siegmiller is Vice President of Business Development at HIPAA One, and Chris Flores is Managing Consulting of Security and Compliance at HIPAA Healthcare Solutions. So Chris, I'm going to go ahead and pass the webinar off to you. Please feel free to get started when you're ready.
Great, thanks Chelsea, and welcome everybody to the webinar today. NextGen Best Practices for HIPAA Security Risk Assessment. We know that ensuring your EHR software is configured for HIPAA compliance can be a daunting task. So in this webinar, we're going to take a look back at the history of HIPAA. We'll also take a look forward at the trends in the OCR and the audits. Next, we'll review the best practices for configuring a HIPAA-compliant EHR implementation, specifically NextGen. And finally, we'll take a look at some of the HIPAA tips and review some of the compliance tools that Attentive offers to help with the process. So I'm going to pass things over to Steve and Bobby to get started with a HIPAA look back.
Unmuted. Thank you for the introduction, and excited to be here. You know, the reason we show this, we want to show you as someone in healthcare. If you've been in longer than healthcare, or longer than 10 years in healthcare, you can do a virtual raise of hands here. But it's fascinating to see how rapid things have changed. So back in 2005, just a little over 10 years ago, the first YouTube videos uploaded. Facebook dropped the in the beginning, and there's this thing called Bitcoin and blockchain that didn't exist. I'll talk a little bit about that in the next slide. And then I don't know if you've heard of a little group called Android. They were a small startup that Google had acquired. So this is so fascinating that just 10 years ago, these were small organizations. We didn't really know how those would, or if any, I wouldn't think anybody would have thought healthcare would be impacted by YouTube or Facebook or any of that. So you fast forward 10 years, and YouTube now has more than 1 billion users who watch hundreds and hundreds of millions of videos every day. This is a pretty big, area that a lot of the youth and those working in healthcare are frequenting. Facebook and other things, a lot of communication going back and forth. We're connected to family, friends. Bitcoin, they've raised hundreds of millions in VC money, and they are poised to be potentially as disruptive as the internet itself. Google now has over 1 billion active Android users. So the question you're asking yourself right now, who cares? What does this have to do with healthcare and me specifically? We do these risk assessments for large health plans, multi-hundred site clinics, all the way down to the single physician practice. You got one spouse that's the physician, another spouse that's the office manager, brother-in-law is the IT guy. So we've seen it all. we're finding a lot of these breaches are related to, Facebook. Somebody famous might walk in your office and, you snap a picture, throw it out there on social media, you get hundreds of likes. I can't believe, Brad Pitt just came into our psychiatric clinic here, and that, what a cool thing. No, can't do that. YouTube, same thing. A lot of people are watching videos, they accidentally click on something that downloads ransomware. And ransomware, we talked about this on another webinar, Steve and I, it is not the latest fashion trend. Ransomware is something that is not a good thing. It's a cyber attack. They encrypt your data, and then they have the key, and you've got to pay a bunch of money to have them produce that key to you. They're now using Bitcoin to pay for that. And it's interesting to note, according to the FBI, in 2016, there were, just first quarter, there were 4,000 ransomware attacks that were occurring daily, and about 200 million just in the first 3 months of 2016, according to the FBI. So this is interesting as we tee this conversation up, and Steve and Chris are going to be sharing some very, very relevant information, how you can avoid some of the challenges. And real quickly, the 4 reasons that this is so important, understanding these things, ransomware alone, there's a lot of regulatory fines and penalties levied, there's legal fees, loss of business, you've got to report that attack to the media if it was over 500, and brand reputation, and then the cost just to remediate that. So these fun things, this fun thing called Facebook and YouTube and the internet, and these mobile devices can be very detrimental to your organization. So we'll cover a lot of that here today.
Thank you, Bobby. And Chris, there we go. This is Steve Marco. That was Bobby speaking. Thank you for the update. We're going to breeze through a lot of information today to try and raise some awareness in certain areas, particularly with cybercrime. Here's 2014's breaches of more than 500 patient records that have been reported to Health and Human Services. The overwhelming amount, and this represents a trend all the way dating back to when they first started tracking this information. Theft, loss, and improper disposal were at the top of the charts, if you will, in terms of the highest probability of having to report a breach. So that's why encryption and like any data at rest, particularly the highest number of breaches deals with laptops, stolen desktops, thumb drives. Those medias, anytime you have ePHI data on a thumb drive, a laptop, you must encrypt that hard drive. Mathematically, you're reducing your chances of having to reduce a breach dramatically by employing encryption. Unauthorized access was number 2. It dealt with the folks, kind of like Bobby was mentioning, posting what happens in the clinic on Facebook or Pinterest, social media afterwards. Logging into your EMR NextGen or your EMR, it's important to review those logs and see which staff members are accessing what patient charts, and making sure that those are not for anything other than treatment payment or healthcare operations. Then hacking or IT incident, although it was low in terms of the number of incidents, it affected the highest number of records. Fast forward to today. Okay, we got a bit of a delay on the keys here. This is the first quarter of 2017. So these numbers were released, and theft, loss, missing, that number does not include improper disposal, is actually high. It's very, very high. It's still the highest reason, but hacking incidents, even though the number of incidents is increasing, the number of individuals involved is much, much closer. So I think what we're going to see is hacking and IT incidents are going to be very high. What's really interesting is if your data is encrypted and you have a ransomware attack and they encrypt your encrypted data, they don't actually have control over it because you have it encrypted. So needless to say, ransomware, there's no silver bullet in security. There's always a weak link somewhere. but certainly encryption is something that is probably the biggest bang for the buck in terms of reducing the risk of loss, improper disposal, and in this case ransomware as well. It is another line of defense. So we got a poll question here. Just to give you a second here, we're going to ask you here, we're going to ask a series of poll questions throughout the presentation today, and this first one is very simple. We're asking if your office has ever had a patient complaint, and here we have Pat working with a patient, and according to this, the physician can't share any information with the patient because of HIPAA. Chelsea, if you go on, please go ahead and put the poll open. We're going to give 20 seconds here, and while we're asking this particular question, wanted to note that in the event of, if you're in doubt in terms of whether you can release patient information, if it's ever for patient safety, for treatment or payment or healthcare operations, instead of defaulting to no, like the cartoon did, please default to yes if it's for those reasons. Okay, so as we're going through the questions here, we're going to close the polls here in 5, 4, 3, 2, 1. Okay, thank you. Let's go ahead and close the polls. We got the results here. I think people can see the results. There we go. So the vast majority has had a patient complaint. That is very interesting, considering some are not sure. I'm certainly not sure if we've ever had a patient complaint. The high number of patient complaints indicate that you've been in business for more than a year. So this is hopefully they're able to be resolved before they were reported to the Office for Civil Rights. Those patient complaints in some cases are going to require access to the logs within NextGen or your EMR to provide any disclosures that were released. Very interesting results. Thank you very much. We're going to, for those that were not able to participate in that poll question, we are going to be asking a few more of these poll questions, and thank you for answering them. It helps us cater the content. Specifically, you know, we're going to talk a little bit now. You know, this is an educational series, so there's been a lot of updates over the past few years in terms of, you know, meaningful use, stage 1, stage 2, modified stage 2, modified stage 3. We're getting into the different states where we're dovetailing that into MIPS and MACRA and so forth. There's been some updates as well in terms of what the requirements are. So Chris is going to jump into a user guide that will show how to configure NextGen, not only for HIPAA compliance, but in those patient complaints, like we mentioned, you do need to ensure that we have settings that are set correctly. Now, all of this awful stuff we have up here on the screen, we're not going to cover this in great detail. I'm going to summarize all of this information. This is what NextGen and other EMRs that are certified had to go through. They had to demonstrate audit logging, the ability to edit patient charts, to go back and do amendments. So if you have to make a change on a patient encounter, like well after it actually happened, these are all requirements now by the federal government. It's something that should be done anyways. What's important to take away from these requirements here for meaningful use attestation using a certified EMR program is that there's not only these requirements that NextGen had to go through to get there, but as a clinic, as a provider of healthcare services, that you are going to have to be prepared to field those occasional patient complaints. That it's important to configure your software so that you can go back and you can mine all the data you need from an access perspective to make sure that you can facilitate and you can hopefully remediate that patient complaint before it goes and gets notified to Health and Human Services. So a quick look ahead. I'm not going to jump into all these details here, but basically looking forward to 2017. So the Office for Civil Rights is the enforcement arm of Health and Human Services. They're the HIPAA police, basically, and we're under a new administrative team. Okay, Mr. Sessions is now in charge of Health and Human Services, and we Price. Sorry, it's just trying to keep up with all of the changes there. One thing that has remained consistent is with the Office for Civil Rights has released their updated audit protocol last April, and they are preparing for the next round of their random audits. So you ask yourself, why is the OCR doing this? They're doing this because the industry is not ensuring that patients have their rights honored. The industry is not making sure that the data is secure, as obviously healthcare has become a target for ransomware, for hackers, as well as for those wanting to commit fraud. So looking forward, we need to make sure that we have our technical safeguards in place, administrative safeguards in place, and physical safeguards in place to make sure that we can proactively, detectively, and retroactively remediate problems before, during, and after they occur. We're going to see more guidance coming out in terms of the Internet of Things, how everything is now connected through the Internet, and how you may be using business associates, third-party portals to host your patient information to provide some of the services to those patients through you. There's going to be more attention paid and more development in those areas, in addition to the mobile devices and the encryption that needs to happen. There were many predictions back when when Donald Trump took the presidency that there would be a major cybersecurity issue within the first 100 days of the presidency, and we certainly agreed with that prediction. And as it turns out, it ends up being trying to get forensic evidence on the influence that the Russians had on the actual election. So we are seeing, though, that there's still many breaches happening within healthcare. So that is what to look forward to, is to protect yourself proactively. And we'll go into some details here. Chris is going to go into how to configure NextGen to help alleviate some of those risks. Our next poll question. So speaking about HIPAA risk analysis and getting those administrative, technical, and physical safeguards in place, question for y'all. Of course, if you're using Itentive, you don't have any concerns about this, but looking back on your risk analysis, if we could just have a quick question here in terms of doing your risk analysis, what's been your biggest challenge? What's been your biggest challenge? Is it time? Is it money? Is it maybe knowing if it's done correctly or completely? Hopefully you have it available to you. The OCR can audit and ask for these documents up to 6 years in arrears. So hang on to those documents. Make sure you have those 2011, 2012 risk analysis handy if you do. So we have the poll question. Ask everyone to please participate. Answer the questions. We're not tracking who did what. This is these are completely anonymous. So we're going to close the polls here to keep moving in 5, 4, 3, 2, 1. Thank you very much. And here's the results. This is, this is fairly in line with what we're seeing in the industry. Bobby talks to a lot of folks that are doing that are in healthcare, and this is something that was going against our predictions. We thought it would be we don't have the money or the time, and certainly the time is a problem. But here we go again, knowing if it's done correctly or completely.
It's interesting. I was, this was probably about 3 years ago now, that I was back in Washington, D.C. meeting with an influential figure relative to, security risk assessments, what was required. And her statement was 68% fail because they didn't do it correctly. So this is interesting to see that it maps here, and it's a pass or fail. It's not congratulations, you got a 95%. You either did your risk assessment or you didn't, but they were dropping the plow a little deeper and going through, did you cover the physical, the administrative, technical, and organizational safeguards? This is the audit protocol that we want you to go through. And they're finding that most people were either strong on the IT or strong on the policy and procedure, but they missed so many components of the risk assessment. And I think that's the advantage of having a group like Itentive walk you through the process, hand-holding you through it. You don't miss these things. And with that comes, at least from the HIPAA One side, a guarantee, 100% guarantee that you will pass your audit. We cover all that you need to. There were about 880 updates last year, just to security, that we had to take some time, update the software. We follow the federal regulatory changes as well as state and local. And this is nice because you don't have to. Again, there were about 62 policies that were introduced to the software recently because of some of those changes. So if you're one that loves to follow the legislative changes and that's your thing, awesome. Communicate with us and you know, we'll compare notes to make sure you've got it. If you're one that doesn't want to have anything to do with it, you just want to go through the risk assessment, you know, it's covered for you. So.
And you know, it's a really good point on that. 68% didn't do it correctly. What you'll find is in the earlier years of meaningful use, I'm talking circa 2011 to 2013, you're going to find that if you did something, that they will most likely work with you to make sure that it's complete, but they will most likely give you more forgiveness than if it's in the later years, particularly 2015 onwards.
Absolutely.
They have gone from, well, you didn't know, so you did something, we understand, you know, you tried. That's not enough anymore. Now you actually have to address the proper audit protocol. You have to have the right controls in place. So if you are not sure you've had this done, obviously reach out to Chris. Chris is an amazing auditor. He will help derive forensically what information you have done, and using HIPAA One, we can actually generate a report for you that will contain all of those physical, administrative, and technical safeguards. Can we get off from the poll and go back to the presentation? Thank you very much. And without further ado, I will allow reintroduce Chris here. Speaking of the devil, Chris, please jump in and take us through the NextGen Security Configuration Guide.
Great, thanks guys. In order to help meet our HIPAA and meaningful use requirements, our friends over at HIPAA One have developed this guide NextGen users can use as a how-to to resource in configuring NextGen applications to meet HIPAA compliance standards. It's a really complete white paper. Also, it's really more of a user guide to kind of take you through the requirements and how to configure those in NextGen. I know most of us on the phone are using NextGen, so obviously this is very applicable. If you happen to not be using NextGen, obviously the requirements are still in place, so you just really have to find out how to use those in your application. We'll review the specific HIPAA standards and then take a look at how to configure all those to NextGen to meet those standards. Everyone on the call today will receive a copy of the white paper, so you don't really need to worry about taking notes and screenshots of the following slides. All this information is pulled directly from the white paper and you'll receive it after the webinar is over. So the first three requirements we'll cover really don't require specific configuration in NextGen. They really require a workflow process applied in the use of NextGen. The items deal with provisioning NextGen users. So firstly, we need to develop a process where department heads approve access for individuals before accounts are created. This ensures that only the authorized users have access to the EPHI in the application. Next, the process should include granting access on a need-to-know or least privilege basis. So users should have access based on the minimal amount of access required to complete their jobs. And finally, there should be a method to review potential brute force logon attempts, which we actually can configure in NextGen. The idea here is that if we should be able to identify any malicious user that's repeatedly trying different passwords to gain access to a privileged account. So the first step to configuring this in NextGen is to deactivate users after a number of failed logon attempts. So you'll open up System Administrator and make sure that the deactivate users checkbox is selected and that you've set an appropriate number of invalid logon attempts. There isn't really any guidance to exactly how many logon attempts. What you want to do is try to tailor that number to something that is reasonable and doesn't go off for some of the users that forget their passwords. Next, in the advanced audit utility, we want to ensure that account lockout by failed logons is checked. This will ensure that these events are tracked in advanced audit, and it'll allow for us setting up a report and a regular review of any excessive or failed logon attempts that we can look at more in depth. HIPAA also requires that we apply some password management settings to our user accounts. So best practices for healthcare include things like 8-character minimums, password complexity, combinations of uppercase, lowercase numbers, special characters, forcing password changes every 180 days, and refusing the reuse of the last 3 passwords. The HIPAA standards don't really spell out exactly what the settings should be for these items, but the ones we've identified here are really what are considered best practices for healthcare. So there can certainly be some discussion in your organization over what the right settings are, but they should really look something like the settings we have here. Password management items can be configured in System Administrator, again, after spending some time deciding on the appropriate settings and after communicating them clearly to your user base, the items can be configured in NextGen. This is one of the ones I see that's usually one of the real pain points for users. So an informational campaign and plenty of advance notice are really good ideas before implementation. You also need to keep in mind that if you're using Active Directory integration, these password management items can also be configured in the operating system. So you can take a look at group policy objects to be able to set those as well. In order to ensure HIPAA compliance, the use of the PIN functionality was removed out of NextGen as of version 5.8. I know a lot of you remember that you could just type that 4-digit number and get into NextGen. That's been removed. Now valid choices for access are individual NextGen user accounts, or like I said before, integration with individual Active Directory user accounts. Something to keep in mind is that even if you're using Active Directory integration, there are some administrative functions in NextGen that still require the use of NextGen account credentials. So you still need to keep in mind that we'll need to use the best practices for account management over those NextGen accounts as well. So again, back in System Administrator, each user should have a unique user account to provide for accountability in using the application. So in System Administrator, we can take a look at all the different user accounts and be able to identify any ones that are generic and really ensure that there are no generic accounts. We really want to make sure that everything that gets done, there is an audit trail, and we can link that back to a specific user for accountability that's required from HIPAA. So you can do that here and also take a screenshot to be able to keep a document of having reviewed this setting. One of the things we talked earlier about OCR giving some additional clarifications, one of the requirements that they added was really being able to accommodate some additional privacy for high-profile patients. I don't know why Brad Pitt is the example that we always use, but it always seems like Brad Pitt is the one that comes up. So if some, mayor of your city, the governor of your town happens to be a patient, we want to be able to give that person some additional privacy so that people aren't just kind of cruising the software looking for their name. So back in System Administrator, we can use the box in red here, this inclusion and exclusion list, to be able to add people into those lists, to be able to give them some additional privacy and have it so that they can't just be viewed. Just keep in mind the people you add to the exclusion list will need to make sure that you have a procedure for being able to access those users so that they don't have to call an administrator every time they have to be able to access a user. Meaningful use also requires the certain level of audit logging and even protection of those audit logs for everything that we capture. So we want to make sure that in NextGen Advanced Audit, we want to make sure that all these features are on. Some of these features and functions are added depending on which version of NextGen you're using. So it's always a good idea to review advanced audit settings after an upgrade and ensure that all of the new ones that are in there are checked and functioning. There's a lot of information that really captures a ton of data, and we want to make sure that we haven't missed one of those because it got added in a later version. So going back to the issue of least privilege, HIPAA requires that only authorized individuals be allowed to edit ePHI. And the way that we accomplish this at NextGen is through the use of group permissions. One point to remember here is that if a user is a member of multiple groups, they will inherit all of the rights and privileges of all the groups they are assigned to. So we really want to make sure that the organization spends some time defining groups, their associated permissions, and which users should be assigned. And then we'll want to make sure that we go through the operations and modules to make sure that only authorized groups can edit or write to ePHI. And then finally, there should also be a process that you regularly review the group memberships to ensure that any disabled users or people are in the right groups. I know sometimes people, will change jobs and you wind up getting some administrative creep there where somebody gets added more permissions because they're doing something, but then they change to a different role. We want to make sure that we're regularly reviewing these accounts to make sure that the right person's in the right group. There's also a requirement that for a process that documents an accepted or denied patient amendment to the chart. And the way we accomplish this in NextGen is to use the demographic settings so we can track and handle the patient disclosures and the amendment process. This is one that a lot of places struggle with, so we will want to make sure that we have a good workflow process that's in place, a policy procedure documented that explains how we actually handle patient amendments. In order to ensure that we can secure patient data sent over interfaces, we're required to maintain a list or diagram of all patient interfaces, including their type, destination, direction, whether they're internal or external, and their purpose. So this one, again, if we're talking about HIE gateway interfaces, we can go into the Rosetta Management Console, be able to identify all of the interfaces that are in that console, record them, and track all of those different pieces. Another tip here is to make sure that you include all interfaces, even including any test interfaces that can access ePHI, because we're going to want to make sure that we can adequately account for all of the interfaces that possibly can send out an ePHI. After Rosetta's done, we also needed to consider NextGen Share if that's something that you're using. These can be found by accessing the NextGen Share portals. And a good tip here is we're going to want to make sure that we're doing both production and staging for those NextGen Share interfaces to record those as well. We're also required to protect information that may become accessible from a workstation that an authorized user has walked away from. We achieve this by setting a session timer or a mechanism that will log off or lock the user after a period of inactivity. This is another one that we struggle with for user accounts. What's the right amount of time to be able to set? So the way we do this in NextGen is we go into user preferences. Alternatively, some users handle this by applying a screen lock or a log off at the workstation level through the operating system. But in either event, we need to ensure that we're protecting this data in the event that a user walks away from their workstation while they're still logged in, which in a busy practice happens all the time, right? Somebody just walks away for what they think will be a couple of seconds and it turns into 15 minutes. So we want to make sure that we have some kind of mechanism in place to be able to protect those screens.
Thank you, Chris. Hey, is there any questions from anybody? He kind of flew through that. A lot of good information. Keep in mind, we are going to pass along the slide deck to you, so you'll have access to that. And then also,
as well as the white paper, so they have actually all the different information.
Absolutely. So you'll have a lot of content, and then you're welcome to reach out to Attentive for additional information. So, and then Chris, I just want to make one point. We are doing really well on time. I wanted to point out the reason we're so concerned with Brad Pitt, the whole Brangelina thing threw us all for a loop, and we're concerned for his well-being. So, no, I'm kidding.
I know, I'm still weeping from that as well.
Yeah, well, I was laughing. I thought, nobody knows who their mayor is. The only reason I do is because I'm in a bedroom community, but I don't think anyone knows who's the mayor of their town. But maybe we come up with another superstar. Anyway, very good information. Chris, we've loved working with Itena for the past few years. So, poll question, if we can throw that up, what is your biggest concern relative to HIPAA compliance? Is it the data breach? Is it the access? Storing, ransomware? I mean, what is one of your biggest concerns? So take a minute to answer that. Have your own side conversations about Brad Pitt in your office and the heartbreak that it has caused you. And we'll give you just a few more seconds here.
I still can't recover from the Jennifer Aniston breakup.
Yeah, that's the one we were upset about. That was, from Friends. That was the big one. Okay, so data breach. Looks like data breach is leaving. It's about tied between ransomware and home remote help, or remote access. Let's give about 4 or 5 more seconds here. 3 and 2. Last people click in, and let's post the results here. Interesting. So data breach, biggest concern relative to HIPAA compliance is a data breach. So let's actually end ransomware. So
encryption, folks.
Yeah, there's so many different ways that your organization can be exposed or subject to. Chris had mentioned the random audit program. We had a client. I just want to spend a minute on this. We had a client last year. That was selected. She called me and said, Bobby, I couldn't win the lottery if I wanted to. And I was selected for this wonderful random audit program. What is it? And we're worried. And I wanted to give her our original tagline, HIPAA One, better than Ambien. This will help you sleep at night. You don't need to stress. You don't need to worry. You've got everything you need. So long story short, they responded to that random audit, and they passed with flying colors, obviously, but we had a conversation, and I wanted to know what were they asking, what were some of the big points, and she ran through this list of items that every practice is going to need, and it is a security risk assessment, it is policies and procedures, it is proof of HIPAA compliance training, it is a corrective action plan. In the past, let's call the OCR the teacher, they used to say, hey, who did their homework assignment? Who's done their risk assessment? And everyone would raise their hand in the class, and the class would shout for joy, and the teacher would say, great, A+ for everyone, and move on to the next subject. It is a different game today. We had our first client in January call us and say, hey, there's this portal that's been created. I'm being asked to submit this list of information. I said, let me guess. Your first and last, or your last year's HIPAA risk assessment, your current year's, and I went through that same list, policies and procedures, HIPAA compliance training, compliance program, final report, and he said, yeah, how did you know? And I just said, well, I'm just smart, and I have women's intuition. But the real thing is he was prepared. He was prepared to submit all that information through the portal, pass with flying colors. That brings us to this point. How can we be so lucky to be audited? It's not just the random audits anymore. If you have a breach-related incident, you are required to report to the media in some cases and report that to the Office for Civil Rights. That is a guarantee of an audit. You have a patient complaint, breach, whistleblower. There are so many different ways that you can be audited. So we can see ransomware. Let's go back to Facebook. You click on a banner ad, nice malware's installed, and you've got to pay. And the problem with paying, it seems to be the easiest thing to do. They used to hack in, grab your data, and sell it on the secondary market. Now it's easier to just encrypt your files and have you pay the fee, and they're gone. The challenge is the more we pay, the more money they have to come up with better ways of tricking you. And they do come in many shapes and sizes, emails that come in through your inbox that you're clicking on and installing things that you shouldn't. So a lot of ways that they're getting you now that you need to be aware of, and that's where this HIPAA awareness training comes in. But let's go to the next slide real quick, and we'll talk about 5 things that you can do very quickly to let's see, are we already to a poll question? We should be.
No, this was the poll question.
All right, there we go. So automated HIPAA security risk assessment. There are ever-going changes to the regulatory requirements. First step, do a risk assessment. You've got a group, ITENIV, that is willing to do that for you. Very quick, very painless. They'll walk you through the process.
Yeah, but just one thing to mention there as well, the output of that risk analysis using ITENIV is that they're going to come up with anything that could potentially result in a data breach. A ransomware attack is going to be at the top of the list in terms of high risks, and it provides guidance on very practical steps on what to do to help protect yourself.
Great point. Encryption, Steve mentioned that a little earlier. You may say, oh, we don't need it, or we don't have it, we can't afford it. In this scenario, you might have somebody, a physician, that is doing mobile visits, in-home visits. You could have somebody that takes a laptop home. If that is ever lost or stolen, or a child is using that for a homework assignment, playing video games on, regardless, if that device is not encrypted and somebody can access patient records, again, not a good thing. So there's a lot of scenarios in there, and again, you can talk to ITENIV, what is encryption and what do we need to do? And they'll do a quick needs assessment of your organization, or people working from home, remoting in, charting. I mean, what is the DNA of the organization? Here's the challenge, here's the corrective action plan, and they've got you covered. Training and awareness.
Real quickly, just wanted to add that a lot of times we hear from a lot of customers that they really don't have any ePHI on their remote devices, and you would be surprised how that ePHI tends to migrate. If you're doing your own billing, somebody downloads an Excel spreadsheet, stores it on their laptop, and boom, you've got 5,000 or 10,000 patient lives exposed on your laptop. So this encryption, we bang this drum pretty loud, but it's a really important topic.
Well, and good point you bring up there, Chris. It's whether they have information on their device or not, it's access to. Do they have a screen protector, password login to access, some of these systems that may have and may store ePHI in a cloud-based setting. So there's a lot of things that they can do in identifying your organization is unique, and they will go through a lot of those controls and make sure those are in place. So training and awareness, I don't know if you can zoom in on that and see if there's any relevant questions there. We had some questions come in. I'm going to have Steve review those as I hit these last 3 points and go into a quick software demo. Training and awareness, again, policies and procedures. We've got some online training available, through ITENIB that you can utilize. Policies and procedures. We see a lot of folks implement or purchase these libraries, these policy and procedure libraries, and implement a bunch and then adhere to half. If that's you, we would counsel you to be very careful there. It's in the software, and I'll show you here in a second, we have questions that will ask you have a policy and procedure for X. And if you say yes, here you go. Or if you say yes, you upload it, your own policy and procedure. If you say no, we provide a document for you, but be careful implementing things that you may not be enforcing, because you can get in a little bit of trouble there. And then business associate agreement. This is an interesting one. Get one signed with all those providing services to you outside your healthcare organization. And the reason being, at the end of the day, you are responsible. You look at the breach with Bismatics that happened. At the end of the day, the covered entity had to notify the patients, had to provide the credit monitoring and the letters and all. It's
of no fault of their own. They had to notify all their patients and bear the burden of all that notice when it was not their fault at all.
Yeah.
They had nothing to do with the breach. It was the hosting company that actually, it was their negligence that resulted in the breach.
Yeah. So very important you get those agreements signed.
I've got 2 questions here. The recording is going to be available at the conclusion of the call, as will be the NextGen user guide as well. The other question, oh yes, updated HAP. So that's HIPAA audit protocol, top right-hand corner there. So that's those are those 2 questions, Bobby.
Excellent, thank you. And as a bonus, everybody attending the webinar today, for attending, I always like to give this away for free, no charge to you, is you get to take the rest of the day off and give yourself a raise. So thank you for your attendance.
Thanks, Bobby.
Oh, what's that, Chris?
I said thanks for that.
Oh, you're welcome. You're welcome. And if anyone asks, just say Bobby said it was okay. So how can we help? What do we do? Streamline the process. We provide a very comprehensive risk analysis. Chris would walk you through the process to document where you're out of compliance, and then you have an opportunity to update as you go through the process through the software. So I just want to show you some quick slides that'll give you a quick overview of what the software will do. We break it down into roles. Okay, so this is HR director would have 9 questions relative to their specific role. Novel idea. HR is not answering IT-related questions. IT server network manager, they would answer their questions. Now those questions comprise of about 30% of what a risk assessment entails, and we often find, the physician will say, hey, you're in IT, you handle the risk assessment. Okay, even though a third of the questions are relative to their role, it's important that HR director is answering HR-related questions, HIPAA security officer, and facilities manager. You'll have this dashboard so you can see HR director 100% completed, and this is a sponsor view. So normally the individual would only see their specific questions. HIPAA security officer hasn't even started answering their questions. So the makeup of a question is this. On the right-hand side is the regulatory text. This is what you're being asked to adhere to. The left-hand side is our interpretation of the text. So it's simply asking, do you have a policy and procedure for worker sanctions? And it's a simple yes or no. If you answer yes, again, I mentioned this a little earlier, prove it. So attach your most recent policy. If you answer no, well, and again, if you answer yes, there's a little prompt box that's going to say it has to be updated within the last 3 years. If you say no, it will tee up that document for you. And again, all you're doing is a simple copy or cut copy, paste on your own company letterhead, getting it approved by your board or the physician, and that will now be your new policy. And these are these are recently updated. HIPAA One and Steve went through a major update, and you added how many new policies?
There's we used to ask for between 19 and 21. Now they're hovering at 62 policies and procedure documents that they're looking for. They're also, in this particular case, they've updated it to also request if you have any examples of actually employing your sanction policy to, include that in. Of course, you can redact the names as well.
Excellent. Thank you for that. And the nice thing, you can leverage the work from Steve and the attorneys and the many hours and dollars that were spent on those updated policies. And again, it's giving you the basics, the bare minimum, what you need, not a big binder with 1,000 policies in it that are not relevant. Every question will run through a threat matrix within the software. So again, you're not having to calculate risk, what's a high risk, what's a medium risk, what's a low risk. As an organization, you're in healthcare, provide healthcare. Let us take care of this compliance side of the house in calculating these risks. And what we'll do is, as Chris goes through the question and answer and supporting documentation, you'll get a list. These are my high-risk items. I need to focus on these immediately. These are my mediums. These are my lows. But it'll give you a work plan to work from over the course of the next, 3 months to a year. This is what it looks like when you are one of my A+ students. You've answered all your questions in green, and this is the aggregated efforts of everybody involved in this process. So now that we are through the questions, the next slide, we'll kind of hang in here. Bueller.
Yeah, we're not able to get to the next slide.
If we can go to the next slide. Oh, there we go.
We went
about 4 slides. Okay, thank you. So it goes in 3 phases. We've answered all the questions. Risks have been identified. We then go through the remediation. This screen is showing you, and a lot of our smaller practices say we love this part of the service, because we can have this screen, everything's auto-populated. I know it's a high risk, what the threat is, what the vulnerability is. All I need to now do is assign this item to somebody within the organization. If they're IT related, you're giving them to ITENIV. Let them deal with the assistance in updating whatever it is that we've identified in that gap. You put a target date in, and then there's an action plan. And the beauty is it tells you exactly what you need to do. So there's no guesswork on what you need to do as you work toward compliance. The other nice thing is with the target date, I call that the auto harass feature. It will continue to email you every week. You have these 3 items to complete, and will continue to nag you until you do so. So that's another nice element of the software. So the next screen will show the final, wait for it.
Yeah, I seem to,
there we go. This is an at-a-glance view. So those of you on the call, I wish we could have taken a poll question in the beginning to say, who are our attendees? Are you office manager? Are you IT staff? Are you the physician? We typically see office staff as the participants here who bear the burden of getting the organization in a compliant manner. But this would be a dashboard that you can show your physician. Add them. They can't mess anything up here, but on the left-hand side, you'll see the current risks, and we go through and break them out in high, medium, or low, and then also what is unaddressed, opened, or that has been resolved. So very, very quick view that, of where the organization is. On the right-hand side, these are the risks that have been updated over time. So it's nice for them to see at a glance, where the organization is. And then there's 3 other buttons that I want to show you there that are important. And one is the reviewer role. Sorry, up at the top was a reviewer role that you could add them. There we go. The report and the action plan. So the report is going to be this next slide that we'll go to. This is the snapshot in time. This is where you are as an organization. And the nice thing about this report, from an auditor's perspective, this typically would take you weeks and weeks to write. It's a picture going back to college, end of term paper. That's what the equivalent of this report is. The software does it in about 3 to 6 seconds, depending on what kind of access you have, and it's perfect every time. So it will go through on the next slide, just these specific items that need to be remediated. It's you can update. So this snapshot in time you're getting is good, and what you would use to respond to an OCR audit, and covers all the elements of what they're requiring. The ongoing remediation is the auto reminders that you get. Hey, you have a policy and procedure that you need to do, get on it. And it's a simple copy paste, in your own company letterhead, get it approved, and then you're uploading that. But that is the ongoing, that would be the moving picture if this is the snapshot in time. That's the live, living, breathing, working document that you'll go through. So that's just a quick overview of the software and some of the ease of what we can do in helping you get from where you are today to a compliance stance.
Great, thanks guys. That was really great information. I know we're getting kind of up there on time, and I know we have a couple of questions I want to leave some time for. But real quickly, we wanted to make sure that we kind of identified some of the other tools that we have that can help you bring all of this together. Obviously, we have the security risk assessment, which we've just talked to at length. We also have some real-time security alerting. So we have an agent-based monitoring tools that can produce real-time alerts on any security events that should be addressed. This monitoring feeds an automated reporting engine that'll be able to create reports on many of the security events and be able to track significant changes to account security levels, devices with outdated security patches or firmware levels, just to name a few. Finally, the combination of all these tools together, the alerting and reporting, provides us with demonstrable evidence of HIPAA compliance and ensures that we're doing all that we can to avoid a security breach. I know a lot of times we live in fear of an audit, but one of the things we'd like to make sure our customers understand is that we're really trying to avoid a breach and a security incident. And the single best way to do that is to really identify all the different areas that we can have any gaps in compliance and be able to close those gaps as quickly as possible. So everything we do tries to center around that. The next slide really goes through kind of likening HIPAA as kind of like a TurboTax program. Steve, were you going to talk to this one?
Absolutely. Absolutely. I just want to make sure that we have some collection. So everyone here, well, we'll assume most everyone here does their taxes in a timely manner. I know we certainly do here at HIPAA One, and some years are more depressing than others. But on a positive front, let's talk a little bit about a return. And we don't have a whole lot of time, so I can't go into the backdrop of the story too much. But I will say the source of this is a story by ABC News that was done to determine what the best way is to do a tax return. So TurboTax, which is from Intuit, is an awesome tax program. It's $55, and this family of four went through all the questions and got a refund of $1,363, which is pretty impressive considering the cost of the software. They went through a storefront tax office, which was one that they found online that was highly rated online by hundreds of people, and it cost them $400. There were some other, they had some issues in terms of getting called back 2 or 3 times, so it was a little bit inconvenient, but they got a higher refund of $2,400 from that storefront tax office. And then the accountant that was friends and family referred to as $350 one visit, and they got a federal refund allocated of $2,800. So that was pretty interesting, that still you need to have someone that knows what they're doing, like a CPA, in order to help you with your taxes to maximize your deductions. Here's the tricky part though. When they took the TurboTax, the family brought their laptop in, and they had the accountant, the friends and family referred accountant, review all those questions, and found that they had actually answered a question incorrectly. It was regarding the child care tax deduction. So they changed the question, and with the help of the accountant using TurboTax, the combined refund was actually $3,274. So the moral of this story is, it's not just technology. It's not just having a really good professional certified professional like like Chris, but when you combine the two, the technology with the consulting, you actually get the maximum results, the maximum assurances that you did it right, that you're going to be protected from ransomware, from loss or theft. So when you combine people, process, and technology together, it's a very powerful value add. So this is the kind of value you can expect when using Itentiv with the HIPAA One software.
Thanks, Steve. The final thought we would like to leave you with is that HIPAA compliance really is not a year-end deadline. Meaningful use guidelines require a yearly HIPAA security risk analysis, but you don't need to wait until the end of the year to do that. We've seen the last-minute rush to complete the SRA. It leads to an incomplete review of the systems and gaps in compliance. It pushes remediation planning to the following year, often getting a really slow start and really getting a slow start to remediating some of the high-priority issues. And the biggest benefit of completing this security risk assessment is really the opportunity to remediate issues that could result in a breach before the breach happens. So the quicker we can identify those issues, the quicker we can remediate them and avoid the pain of security incidents or breaches. So the idea here is that you really don't need to wait to make this a fourth quarter effort. It can really be done earlier in the year so that we have enough time to really get through the entire process, which includes remediation as well.
Okay, thank you, Chris. So this is our last poll question, and it's a really simple one. Just throw your gut instinct out there. Would you like us to follow up with you regarding these services? So we always love doing these educational webinars. We do them complimentary. Nothing's going to stop that. But just take a minute and let us know if you'd like us to follow up with you. No pressure either way, and no pressure even if we call you and you go, wait, I changed my mind. We'll go, no problem. But this can be a great opportunity to answer any questions as well if they come up to you later. So I'll just give you one more second to finish this and close it in 5, 4, 3, 2, and 1. Okay, so thank you all for that. And I think we're ready to get to our questions now. So questions can be typed in the questions area of the GoToWebinar control panel. And it looks like a couple people already have them in, but not too many. So there's still time to answer all your questions. So let's get them typed in there. First question. Is the audit that is required by HIPAA through advanced audit the brute force attack? I might have missed that part as I had to take a phone call. We have HIPAA One and know that that's what it asks for, but how often should this audit be performed?
That is a good, very good question that we get often in the industry because there is so much confusion based on some of the information. So I have documentation from our friends in Washington that states the risk analysis must be done annually. I also have documentation from our friends in Washington that say periodic reviews or updates must be done annually. That leads to the confusion. Let me say this. It is never a bad idea to have your risk assessment done, especially when there's large changes. And when they do audit you, they are asking for prior years.
So the question is regarding how many times we have to review failed login attempts.
Oh, I thought you were talking about audit.
No, I heard brute force, and that's certainly not. We wouldn't be talking about an audit at that point, right? Brute force. No, it's brute force login attempts would be the if you have a high number of failed login attempts under one user account, typically someone's trying to hack your account. That's really what it is. So smart hackers and most of the scripts that are out there can do 4 failed login attempts, wait for 61 minutes because mostly locking out an account happens every 5 and you don't want to alert the person. So you can set up scripts to do a dictionary of passwords and run day and night, 24 hours a day, 7 days a week. The review of these logs is to basically get the last 30 days and sort it by the person's name. And you don't have to look at every single line, but you can see a pattern on the screen that develops. If you see the same person with several thousand failed login attempts, then you are being attacked. So that's what that is for. We recommend, depending on the size of your organization and the resources you have available, we recommend every 30 days. If not available every 30 days, at least every quarter, to just do that download, sort out the failed login attempts, and just do a quick scan to make sure you don't have a high number.
One of the things that we hear from our customers a lot is that, you know, that advanced audit utility is great, but it produces such a depth and breadth of information that it's really a tough task to get in there and just find the stuff you need to look at. That's why we've developed one of those tools that I talked about. Really just goes through that whole log, and it picks out the security related ones that we want to look at on a regular basis and creates a report that you can review on a regular monthly basis to say, okay, out of all the information in the advanced audit, here's here's the few security issues that you really should take a look at and decide if there's something happening in the environment.
Okay, thank you guys. Great answers. Next question. Can we bulk download the policies, or do we need to go through each question?
So the native functionality of the software is on a per question basis. However, working with Chris and Attentive, they can, you know, you're entitled to that policy and procedures library. So please request that of Chris.
We always provide those at the end of any audit. We always provide a zip file with all of those policies and procedures in there, so you can reference them at your leisure.
Mm-hmm.
Okay, perfect. Next question. Is it acceptable to have an ex-manager, or I'm sorry, is it acceptable to have an IT manager that is an ex-felon?
So there is a HIPAA requirement that we assign to the human resources asking if there's, you know, some sort of employee background checks before hiring. If you know that they're a felon and they have access to all of your patient records, you will have very little to stand up on if that person does something fraudulent with that information.
Okay, thank you guys. Next question. When you mentioned cut and paste for the P&P, is that verbiage provided from HIPAA One, or are you providing the directive of what needs to be in the P&P for the satisfaction assurance of documentation?
Great question. So what we've done is all of the policies and procedures that have been developed through HIPAA One software is designed to meet the requirement based on what HIPAA security is asking for. So you may have a set of policies and procedures, your code of conduct that already exists. Maybe you have an employee handbook. The policies that are provided through the software are the minimum necessary for what is being requested by HIPAA directly.
Okay, perfect. Well, so far that's all the questions we have, but you see Chris Flores' information up on the screen, so if you have any questions, please don't hesitate to reach out to him. We really do enjoy getting questions. We enjoy answering them and helping you guys out. I'll be sending out a follow-up email within the next week that has the link to the recording, the slides, as well as that white paper or quick guide as we've been referring to throughout the presentation. So thank you everybody for your help today. Thanks for joining us, and I hope you have a great rest of your day.
Thank you very much.
Thanks all.
Take care.